colleagues, it's my privilege to invite Professor Sagnik Dey as a guest speaker today for an essential topic, environmental exposure modeling for epidemiology research. Professor Sagnik Dey is Institute Chair Professor from Center for Atmospheric Science, IIT Delhi. A brief bio note about Professor Sagnik. He worked as postdoctoral scientist at the University of Illinois at Urbana-Champaign, USA for 3 years. His research interests are to understand air quality, climate change, and health nexus, and remote sensing of the Earth's climate system. He received many awards: INSA Young Scientist Medal in 2008, NASI Scopus Young Scientist Award in 2012, Dr. Sudhanshu Kumar Banerjee, Ministry of Environmental Science, Outstanding Young Faculty Fellowship for the period 2011 to 2013, and Teaching Excellence Award from IIT Delhi in 2016. Professor Dey has been awarded the Fulbright Nehru Academic and Professional Excellence Fellowship for 2017 and 2018. He is a collaborator of Global Burden of Disease Study and served as an expert from India. He is also coordinator of Center of Excellence for Research on Clean Air from IIT Delhi. His other interests are that he is an associate faculty of School of Public Policy and Transportation Research and Injury Prevention Center. Further, he is a member of WHO Southeast Asia Non-Communicable Disease Regional Technical Advisory Group and co-convener of KFIR India Network. He is also serving as associate editor of Atmospheric Environment and of Helion, and is an editorial board member of GeoHealth Scientific Report and Earth System Dynamics. I welcome Professor Sagnik for today's lecture.
Yeah, thank you for the kind introduction. It's a great pleasure to be here and interact with you because my research interest is to understand air pollution, climate and health nexus, which requires interdisciplinary approach. My personal expertise is on exposure modeling, and I will demonstrate how such exposure data are used by people like you to further understand the impacts on health, because what is lacking today in the country is direction towards sustainable emission pathways. We talk about air pollution, we talk about climate change. However, despite the fact that there is so much literature out there suggesting negative impacts on health, indigenous scientific evidence from India is very little. And that is what is causing delay in the actions. So what I will do is that I will quickly talk about some of the research that our group has done in recent past. As I said, my expertise is modeling exposure, different types of exposure. Today I will talk mostly about air pollution, but at the end I will also touch very briefly about some of the work that we are doing for heat. Now, typically, if you think for air pollution or even heat, ideally what we want is to monitor exposure at individual level, because that's the most accurate. However, and there are actually ways to do that. There are instruments which you can sort of, give to a person, and that person has to carry that instrument, and then you will get minute to minute information about the personal exposure. However, that is unrealistic if you want to scale it up at a population scale. And even when you measure personal exposure in a cohort setting, and this is from our experience in a study that we did with Dr. Kalpana Balakrishnan and Professor Guleria from AIIMS Delhi and many others, we realized that people don't want to carry these sensors more than a day or so. So effectively for a person, you cannot ask them to wear the sensors continuously even for a week. And that is what is leading to us develop exposure models. because we realistically cannot measure personal exposure at a large population scale, we try to model exposure. However, we must keep in mind that when we try to model exposure at larger population scale, there could be chance of exposure misclassification. So we are continuously working to reduce that. Now, in terms of air pollution, if you look at this figure, what it shows is that what is the current ground monitoring network in the country. In Jodhpur, till last year, there was only one ground monitor maintained by Rajasthan State Pollution Control Board. Only recently, 2 more monitors started. However, if you want to understand how air pollution has changed in this area for a long time, one monitor is not enough. And if you see this figure, you see that most of the country does not have a monitor. All these monitors are within urban areas. So we really do not know what is the level of exposure for the people who are in rural area. And obviously none of these monitors can provide information about what is the exposure inside the houses. Now indoor air pollution is often talked about, but that's a different topic. But I must mention that indoor air pollution levels are also quite high in different settings. But here we are talking about outdoor air pollution. And if you try to calculate what is the distance, average distance to a nearby monitor in India, this number is almost 80 kilometers. So you can see that if we have to rely only on these monitors, you cannot really assess ambient air pollution exposure at a larger scale. And that is why we reached out to Central Pollution Control Board and we did a work for them, and where we developed actually a satellite-based PM 2.5 database for the entire country. And again, without going into too much details how the algorithm works, now satellites, they do not measure PM 2.5. What they measure is a columnar quantity called aerosol optical depth. This is kind of a measure of how much the sunlight is attenuated because of the particles. What we have done is that we have standardized, we have converted this aerosol optical depth to surface PM 2.5 because that's the criteria pollutant we are concerned about. And there are many steps involved, but the most important thing is that because it's satellite, it cannot measure aerosols when there is a cloud present. So first we applied a machine learning model to address that missing data. And then eventually you can see that from AOD, this is just an example of 1st January 2021. This is the columnar aerosol optical depth. And then we converted it to PM 2.5. So one important thing you can see is that higher aerosol optical depth does not always mean higher level of pollution at the surface, because it depends on the meteorology, the weather conditions, as well as whether the particles are closer to the surface or the particles are up in the atmosphere. And this is just one example, 1st January 2021, this is the PM level for the entire country. In some places the values are more than 160, some are quite clean. And this type of data now we have daily scale for the last 23 years. So we have data from 2000 and we are continuing. And we have evaluated obviously because this is not directly measured. So you can see that using the ground data, more than 2 lakh data points at daily scale, the correlation is pretty high. R square is around 0.96, root mean square error is around 11. Annual scale, obviously, it is even better. So in a way, it says that this data can be reliably used for epidemiological studies, and it has been used, and I will show some demonstrations of that. So this data has been used in disease burden analysis. It is used in time series study to understand the acute exposure impact. It has been used in cross-sectional studies, and now in retrospective and some prospective cohorts also, this data is being used. But before that, I just want to show you what is the seasonal cycle of pollution in India. We talk about it. What you see here is that this is the picture of 1st January, and what I have done is that because we have the last 22 years of data, I have picked up all 1st January, averaged it out. So in a sense, you can see that this is not just 1 year, but kind of long-term representation. And if you see this particular figure, you can understand that air pollution is not just an urban problem. In fact, the entire Indo-Gangetic plain, all the way from western border to east, the values are in the excess of 80 to 100. National ambient air quality standard on Delhi scale is 60. So it means that anywhere you see blue color, only those are the clean regions, so to say. But keep in mind that the 60 itself is also many times higher than the WHO standard. There is okay. Now you see that in this video, as the time progresses from January, you see obviously there are day-to-day differences. In summer, we all know that strong wind clears the air. So you see middle March or end of March, many of the central India becomes relatively cleaner. Not so much though this part, because you have now in summer dust emitted from the desert by strong wind. And although this central India and even the eastern India is relatively cleaner, you continuously have dust coming. And then you see in monsoon, most of the country is clean. You don't get much rainfall closer to the desert. So sometimes even in monsoon months, you get this dust emitted. And again, as soon as the monsoon retreats, you will see that again the pollution builds up, and you have heard about the smog, stubble burning and all. Now you see in October, you see very high level of pollution, not just emitted here, but the pollution is sort of spreading from west to the east, and this cycle then continues. So in a sense, you get a sense that this air pollution is not city specific problem, it's a regional problem. And most importantly, air pollution is typically seen as a winter problem. And now with this kind of data, you can see that it's actually annual level problem. The only thing is that season to season, your source characteristics change. Now, as I said that this kind of data is now used in GBD. So what GBD does is they have given a universal framework to calculate the disease burden based of our knowledge. So 6 non-communicable disease, the response functions are available: IHD, COPD, stroke, type 2 diabetes, LRI, and preterm birth. And you can see that there are 3 determinants. Attributable fraction is the relative risk depending on the exposure itself. And then you have baseline mortality and population. So what we have done is that not only we have calculated or contributed rather in the calculation of the mortality and morbidity burden in the GBD. As an environmental scientist, we do a lot of modeling. So we wanted to understand that, okay, we know there is a pollution, but can we say what are the sources of these pollutions? And this is exactly shown in this figure. I will take some time to explain this figure. So you see that these are the GBD numbers for each state, which is shown here. So Delhi, Goa, Himachal Pradesh, like that. So Rajasthan is here. And the estimates is that because of air pollution, and this number is for 2015, in Rajasthan state, this is in thousand, so this should be read as 39,900 deaths were attributed to air pollution. But that's not the only information here. What is interesting is that now this information, there are 2 different columns here. First, I will draw your attention to the left panel, where the burden is apportioned into various sources. And if you see, what is emerging is that in almost all states, this green bar, which is the secondary emission, and then rest of the sources are actually primary emissions. Now, what is emerging is that secondary emission sources play a major role. What are the secondary emissions? Is typically the emissions of SOx, NOx, ammonia, this kind of gases. Now, if you measure those gases, you will not find their concentration high because our country is a tropical country. So what happens is that if you emit these gases, so if there is an industry, if it is burning coal or any fossil fuel, it will emit these gases. And the moment these gases are emitted, they react in our atmosphere, then gets converted to PM 2.5. Now, because of this, you see that so much contribution is coming from these secondary sources. The other important point is that if you look into all the air quality control that is going on today, the emphasis is on primary dust. And we are forgetting the fact that so much contribution is coming from secondary sources. Now, obviously, Rajasthan is closer to the desert, so you have a very large proportion of natural aerosol or dust. Now, the right panel is very, very interesting. What it is showing is that how much of the pollution is coming from the emission within the state, which is this color, how much is coming from the neighboring state, how much is coming from long distance, that means within India, but outside the neighboring states. This color code is for outside India and this is natural. So if I pick up Rajasthan, you can see that Rajasthan's own contribution is only this much. Because it has a border, so there is a huge contribution of dust and neighboring state and even from outside India. And obviously this number varies. Like for Delhi, from where I belong to, you see that almost 50% is Delhi's own contribution. Then another 35% is long distance and all. And obviously this is very interesting because what it tells us is that all the states need to really join hands. Otherwise, you can only solve 30 or 40% of the problem. And I will show some results also just for the city Jodhpur at the end. Now, what we have also done is that using the GBD framework, we tried to understand, because you all know that government has launched the National Clean Air Program to reduce the pollution. So, I calculated here that corresponding to baseline, let's say 2017, which is the NCAP baseline, if exposure reduces by 40%, which is the NCAP target, by 2026, how much the burden will change? Now, you will see that in most countries, if you just compare red and blue curve, the burden, for example, in Delhi, the burden definitely will not change, even if you reduce your exposure by 40%. And there are some states like Goa, obviously the burden is coming down. Why is that? Because, as I showed earlier, the burden not only depends on exposure, but it also depends on the population. Now, in many of these states, the population growth is very high. Even if you reduce your exposure, that benefit is getting nullified by the fact that your overall population is increasing. And not only that, in many states, the population is also growing to the older age. And the risks of exposure to air pollution is much, much higher at older age than younger age. So the states where the population fraction of older elderly people is high, the burden will also remain high. And it clearly tells the policymakers that you cannot address air pollution problem just by reducing exposure. You have to work on these determinants that are socio-demographic variables. And also baseline mortality plays a major role. Now, many of the diseases that I mentioned, their baseline mortalities are increasing. Now, baseline mortalities implements, the risk from all different factors. So if the baseline mortality is high, obviously when you apportion some of the burden to one particular risk factor, that will also be high. So what it tells us is that all these social, demographic and epidemiological factors need to be brought under policy, and you cannot just say that, okay, we'll reduce air pollution exposure and that will do the trick. So that's a very important message from this slide. However, I must mention that GBD has provided this beautiful framework to understand But there are certain assumptions, and this is very important for a country like India. The first assumptions we are making is that the risk only varies with total PM mass. There is very little evidence whether PM composition actually matters, and we all know that there are different sources. As I showed that in Rajasthan, mostly it is dust. In some other places, it could be completely coming from industry or vehicles or somebody else. Now, what is the toxicity level and whether that matters, we do not know. And obviously, there are many more health outcomes for which integrated exposure response function does not exist, but there are scientific studies. Now, what is important to note here is that the WHO air quality guideline, which has been revised last year, it is kept at 5 microgram per cubic meter. And this study, not by us, but one of my good friend, they have shown that if you completely stop all anthropogenic emissions globally, what should be the PM level? And if you see, in India, the PM level will be around 10 to 30. So it means that no matter how hard we try, we can never reach WHO air quality guideline, not just India, but almost all countries, because there is so much background dust. And that is why it is important to understand whether dust is as lethal as particles, let's say, emitted by transport or industry. Now, so the question is that, does PM composition matters? And again, we are working with multiple collaborators to understand this using different study designs, time series, cross-sectional cohort. Again, the challenge is that if you now go from PM to PM composition and sector, there is no exposure data because you are not directly measuring how much is coming from transport versus other sectors. So what we have done again is that we have developed this kind of exposure data by running a chemical transport model. And I'm not going into details, but what we have done is that we have integrated model and satellite data to generate information about this different species. You can see black carbon, which is a product of fossil fuel burning, organic carbon, which is a product of biomass burning, dust, sulfate, this is the secondary particulate matter, and sea salt, which is coming from ocean. So this is just one example, but we have much more detailed information, and you can see that their spatial patterns are quite different. And then very limited measurements are available. You can see that it does reasonably good job. But if you have this kind of data, you can then further do a lot of studies to understand. Now here I am showing one example of time series studies. So first I am showing from literature, there are studies where people have tried to understand short-term increase in PM10 exposure, whether it has any impact on all-cause mortality, because all-cause mortality is the data which is easily available. And you can see that from Delhi to Ahmedabad, there are different ranges, but yes, if PM10 increases, there is an increase in all-cause mortality. Obviously, you have to adjust for the confounders and all. But from PM10, if you now consider PM2.5, in 2 cities, studies are available now in Varanasi and Delhi. There are 2 studies in Delhi, in fact, they are giving almost comparable results. And you see that, first of all, in Delhi, if you use PM2.5 as a metric, the impact is definitely more than PM10. Then we went further and asked the question that we are talking about PM2.5 or PM10, but what about compositions? So this study done in collaboration with AIIMS Delhi. By the way, AIIMS Delhi and IIT Delhi have an MOU to further, promote research, interdisciplinary research, and that actually really helped our group, because in our group, a lot of students are working, but we do not have any sort of medical background and all, and that's what the expertise brought by the AIIMS Delhi colleagues. Now, same results you can see here, that excess mortality per interquartile range, and these are actually the relative risks. So what you notice here is that for each of the different species, like ammonium nitrate or chromium or ammonium sulfate, there are 2 colors. This blue is for male, red is for female. So most of these species, what we are noticing is that the impact on male is larger than female. And second is that some species are showing much higher impact. For example, ammonium nitrate, and even when you consider separately nitrate and ammonium, then elemental carbon, which is basically the black carbon and all. Now dust is somewhere down the line. Oh, sorry. Dust is here. So you can clearly see that the impact of some of these species which are coming from industry, vehicles, and this kind of sources have much larger impact than natural dust. This is time series study. Then we did a cross-sectional study. We did now many, but I'm just showing one example where we first show that PM exposure is a risk factor for anemia. And just to give you the perspective that 10 microgram per meter cube increase in long-term exposure, there is a significant association of increasing anemia prevalence. But when we again repeat the analysis with different species, you can clearly see sulfate and BC, the odds ratio is much, much higher than dust. And in fact, here actually dust is still showing some higher value than organic carbons. So there are these differential impacts coming up. Another study which is under review currently, where now we looked into 3 child health outcomes from National Family Health Survey: low birth weight, child anemia, and acute respiratory infection. This is for the species, and these panels are for the sources. Same results, you can see that some of the species are showing higher values like ammonium, nitrate, elemental carbon. Dust is on the lower side. In fact, dust has no impact on acute respiratory infection as far as this analysis is concerned. And the same thing for sectors. You can see that transport has a very high impact. Domestic has a high impact, and then again in industry and all. So depending on sources, there are differential impact. In India, we do not have studies to understand what is the actual biological response, but there are studies conducted in US, Europe, and other places where they have shown that the biological response to different types of particles is very different. So one can conclude that yes, there is no consensus as of now that across a wide range of health spectrum, which source is more lethal. But what can be very surely concluded that toxicity plays a major role, and we have to move from PM mass based to PM composition based matrix. But so far we are talking about PM, but we all know that when it comes to air pollution, it is not just particulate matter, right? It's a deadly cocktail of various components in the air. Even in Jodhpur, if you measure, you have high PM. There are many other pollutants. In summer, ozone is important, NO2 is important. So what we have done is that we realize that in India, there is not a single study conducted in a multi-pollutant environment. Not a single study. And the reason is that multi-pollutant, again, you do not have good exposure data. So we have recently developed NO2 exposure data as well. And this is just one example, that this is the satellite derived columnar NO2. You can see how the NO2 is spatially distributed. And the regions where you see major power plants, you see very high NO2 hotspot, because you burn coal, you emit NO2. Now NO2 is a gas whose lifetime is very short. If you emit NO2, very quickly it gets converted to particulate matter. So in a sense that if you are measuring NO2, it means it's giving you very good idea about the local emission sources. And also transport is a major contributor or emitter of NO2. So anywhere you have very high vehicular population, you will get very high NO2. Now we have used this kind of data and developed actually NO2 exposure database for the entire country. And we can see that this is how the NO2 exposure looks like. Again, reminding you that our national NO2 standard is also 40 and WHO standard is 10. Even if you consider 40, you can see that many places the values are exceeding. And then we are trying to understand the source characteristics of NO2. Now, interestingly, NO2 is also produced due to lightning. and it has nothing to do with any vehicle or power plant sources. So many of these places where you see NO2 values quite high, for example, Uttarakhand and many other parts, one of the major sources is also lightning. And again, as I said, this data can be used in epidemiological studies now. Now, the last part, I talked about PM, I talked about some other pollutants. As I said that we also work on heat. Now heat is very important again in Jodhpur and this part of the country. And what we have found is that air pollution and heat in some way are related. And I will explain very simply why they are related, because these particles that we are talking about, they either scatter solar radiation or they absorb solar radiation. Like black carbon and those species, they absorb solar radiation, and if you absorb solar radiation, you warm the climate. Now the particles like sulfate, nitrate, they scatter solar radiation, and if you scatter solar radiation, you cool the climate. And what is the implication is that now if you reduce sulfate particles from air to address air pollution level definitely will come down, but because these particles cool the climate, the consequence will be that now temperature will increase. On contrary, if you try to reduce black carbon, because black carbon warms the climate, not only you address air pollution, but also you further cool the climate. So this kind of analysis suggests that what are the sources that need to be prioritized more. And addressing black carbon definitely has certain advantage. Now this figure in the top panel shows, before that actually let me tell you, when we started working with heat, what we realized is that heat stress quantification is the foremost thing. What is the heat stress exposure? And we looked into literature, we find almost 5 or 6 standard indices that quantify heat stress. There is wet bulb globe temperature, UTCI, humidex, PATE and other things. However, we found that none of these indices actually correspond to each other and represent Indian condition adequately. So we analyzed the data from India Meteorological Department and sort of proposed a new index called India Heat Index, where we realized that not only temperature and humidity is important, but we must consider radiation and wind. And this is what is missing actually in all the existing index. They only looked either in temperature or at most temperature and humidity combination. And this figure shows that what is the difference if there is no particulate matter in the air versus the normal conditions in terms of the difference in heat index. And obviously you see that, as I said, if you clean the air, there will be an increase in the heat stress. And obviously, and then we tried to understand what will happen in future and all. Now, this is interesting and probably more relevant for you, that you see that India is divided into 6 climate zones, and Jodhpur belongs to arid climate zone, Delhi is in semi-arid, and then you have different other climates. So what we have done is that we could get data from Delhi, Varanasi and Chennai, which belong to 3 different climate zones, where again we looked into the acute heat exposure impact on all-cause mortality, and using our new index, we tried to quantify what is the heat stress. Now, what is very interesting to note here is that in these 5 different climate zones, we did not consider mountain because there is no heat stress in the mountain climate zone. In the 5 climate zones, if you see, what is the stress during non-heat wave days, which is the green bar, and heat wave days. Obviously, when there is a heat wave, your stress is much higher. But what it also tells you is that on non-heat wave days in peak summer, the stress is also considerable. It is not just that the heat wave days only are dangerous. Number 1. Number 2, in some of the climate zones, the difference in stress between non-heat wave and heat wave days is very low. Not so much in arid. In arid zone, obviously, the stress is much more only on the heat wave days. The simple reason because here the humidity is quite low. Now what we have done is that we could get data from these three cities, and again we did this analysis. You can see Chennai, Delhi and Varanasi. This is the percentage increase in mortality per unit increase in the heat stress. Multiple things we segregated in terms of 4 age groups based on the data, more than 64 years, then the lowest was actually less than 19 years, then male versus female, heat wave versus non-heat wave days, and then 3 different classes in terms of vulnerability. Sweltering means the most extreme heat condition. Now, if I talk about Varanasi, for example, you can see clearly very high impact on elderly, and this is consistent across all the cities. Similarly, male versus female, more or less comparable impact in both Delhi and Varanasi, slightly different in Chennai. In Chennai, there is no heat wave because Chennai is very close to ocean. However, there is much larger impact on heat wave days in both Varanasi and Delhi. This is the number compared to non-heat wave days, and you can clearly see that as you move from comfortable to very hot or sweltering, that means extreme heat conditions, your risk considerably increases. And these are the first kind of studies because across the country, different climate zones, there was no such estimates, but now we are able to provide some sort of data. And again, this is just a beginning. Obviously, we need to do this kind of study at many different locations. And our ultimate target is that to understand what is the combined impact of heat and air pollution. Because what we have realized is that many of these diseases that we are talking about, and again, when you look into the literature, heat is also playing a major role, pollution is also playing a major role. So far what we have been doing is that when we are trying to understand the impact of air pollution, we are adjusting for temperature variation. When you are trying to examine the impact of heat, we are adjusting for air pollution. And in this way, but we need to understand really what is the combined impact. And now there are studies coming from many other parts of the world suggesting that the combined impact is even more lethal. Now, last couple of slides. So, while I was coming, I thought, I will show you what the data is suggesting for Jodhpur. So, if you simply ask the question, what is the air quality in Jodhpur? As I said, there is only one site which is operating long enough for data. I also looked into satellite data. They are quite comparable. So, if you see, for the last few years, 2017 to 2022, from 1st January to December, how the PM level varies in Jodhpur. So obviously you can see these all variations. Now, obviously this is quite cumbersome, but if you just simplify this here, just average over years, you can see that in Jodhpur, you have 2 peaks. You have a very high peak in summer around May. For the last many years, average PM level in summer is around 100. Then it comes down in monsoon, and then again it goes up exceeding 100 around November. So in Jodhpur, these are the 2 times when the pollution level is really high. We also tried to understand how it varies day by day, hour by hour. And again, you can see that there is an early morning peak around 8:30 or 9 maybe. Maybe because of the, all the activities are starting, traffic starts and all. Then over the day it comes down, and then again late evening it starts increasing. We tried to also understand, is there any weekday, weekend effect? We could not find. Mostly you see Monday, Tuesday, Wednesday, more or less similar pattern. However, if you just kind of average this and see how the variation is across the week, you see that tentatively, Tuesday and Wednesday are showing kindly high values, and obviously Sunday is showing little bit lower values. And this is very interesting. This figure here, this is showing that how the annual statistics changed. And if we see that 2017 and 18, the values are quite high. However, in recent years, there is slight improvement. It is still not clear whether this improvement is because of the clean air actions that the government is putting or it's a natural variation. But clearly, even if the values slightly came down from 2017 or 18, these values are still high. Even if you take the median values, they are above the national standards, no doubt. And if you look into the most recent data like 2022, you see that in last October or November, there are also episodes where in Jodhpur, your values have gone up to 250, 300 microgram on certain days. Now, what is the cause of these episodes? Obviously, need to be examined. But the point I'm trying to make is that many days you see these spikes in the pollution level. Now, whether this is local, whether some dust storm is coming and all needs to be examined. Now, if this is the situation, is there any information at all, like what are the major sources in Jodhpur? There are some modeling studies done by one of my good collaborator. So here what you are seeing is that what they have done is they tried to map the hourly traffic speed, because transport is a major sector in Jodhpur, from different time at what is the typical traffic speed. Because why traffic speed? Because if the traffic is moving at a high speed, the vehicular emission goes down. But if the car is stopping very frequently, then your emission goes up. So that's the reason why it is mapped. But this is interesting. If you try to apportion the emissions, because we are close to the desert, 42% is dust. There is a huge emission coming from transport sector, 29%. Industry contributes 15%. Residential emission is 7%. DG sets 3%. Waste burning 4%. And if nothing changes, then things will be projected like this for 2030. More or less similar. Only thing is that transportation contribution in future will even increase further to 36%. This is emission. Now, if you take that emission and calculate what is the impact on concentration, so this cartoon here shows the source apportionment of PM level for different months. Now, when you talk about PM, obviously you see this boundary, this color. This is basically how much pollution is coming from outside Jodhpur. And that number varies from month to month, but mostly that number is very high. You see, in some months this number is even 40-50%, depending on the wind direction. And in some month, this number is quite low. More or less, your vehicular contribution is 1/5 of whatever you are getting here. These numbers, by the way, are, as I said, a few years old. I know that a latest study is being conducted by IIT Jodhpur. Probably once that study is out, there may be some changes in this number, but it gives a good sense that what is actually contributing. And obviously the industry contribution is around 6-7%. And because there is so much dust, so dust is around 1/3. And then rest of the sources are actually also contributing. In winter months, heating, you see, popping up because it becomes really cold and people actually burn coal and other things to warm themselves. So in only winter months, you will see this heating contribution. Yeah, now you see 14% contribution is coming. So month to month, depending on the conditions and all, the source characteristics change. So last slide, what I feel is that we need to do systematic studies by combining the by combining the exposure data with the health data. And unless we come up with indigenous studies and drive our own exposure response functions, we cannot really guide policy framing with confidence. AIIMS Delhi and IIT Delhi, as I said, under our MOU with support from Health Effect Institutes, we have launched a CAFR India network mainly to promote air pollution epidemiology research. We already organized few workshops to provide hands-on training to early career researchers. There is a workshop planned sometime in August or September. and we continue to work in that way. We need to understand the biological pathways, as I explained. Right now, most of the evidence is from association based studies, and we need to do more and more cohorts to further pinpoint the causal pathways. And obviously, once we understand the climate health linkage, that will help understanding the which sector to be prioritized. And I hope that we will get opportunity to collaborate in future. So with this, I thank you for your patience. If there are any questions, I will be happy to answer. Thank you.
Recently, it was in news that Jodhpur is most polluted city in Rajasthan and fifth in the country. So I spoke to Air Pollution Board and I wanted to know what might be the reason. And their answer was there was some error in reporting. So what are the chances really it was error or we can find out?
No, so from the long term data, definitely it can be find out. But as far as media report is concerned, what I have noticed is that media needs to be also educated. Sometimes what happens is that media picks up daily numbers. See, every day pollution level is there. Now, if you compare on a given day, obviously Jodhpur can be even most polluted in the country. But that's not the way it should be assessed. Whether state or city is polluted, when you do rankings, it should be based on annual concentration. It cannot be based on 1 day, 2 day data. And that is where actually media needs to be educated. It has happened in the past, some random data, maybe 1 week of data, and then you basically say that this is fifth or fourth. But there are standard ways to do this, and ministry is already doing it. But as far as statistics are concerned, Jodhpur is not on the top. Mostly the IGP cities are actually on the top because of the geographical locations and all. But as I showed the data, yes, the pollution level is really high in Jodhpur also.
Thank you, Dr. Dey. It's very informative presentation, and actually it has given us a lot of food for thought. That is, when we see from the clinical perspective, we see a lot of patients coming with a lot of different conditions like celiac disease, and also they are coming with the diabetes mellitus is very common even in children in this region. And thirdly, there is a newborn disease which are very unique in this area. That is, they present with hypernatremia and a dehydration, which is not only during the summers but also in the other, even winters, some cases are coming. And I think somehow the heat and other things are affecting the mitochondrial functions. One study is going on with the neonatology department about the mitochondrial dysfunction which can lead to the disease. So I think these heat and environmental factor, they are going to impact many of the disease which are existing in this area. And in this direction, what AIIMS Jodhpur is doing is that we have a consortium, One Health consortium, in which the zoonotic disease, the agricultural problems and the human disease are being studied. But the missing link is the environmental studies. That is, what is the impact of the environment. We have collaboration with the IIT Jodhpur, and IIT Jodhpur has developed a unique program which is based on the aerogenomics, as well as they have termed it as Thar design. Dr. Mitali Mukherjee is working on that Thar design. So they are studying the ecosystem, how these environmental factors, pollution, the heat and other things are affecting the disease, and how the disease are affecting our behavior. So this is one of Prakriti in Ayurveda. They are studying that how the genes are affecting the Prakriti and how the Prakriti is modulating the genes as well. So there are so many things which can be done in this area. I think this idea of having this satellite data as well as the local ground level monitoring can definitely help. This is very important. I think AIIMS Jodhpur will be able to help and collaborate further in that area. Thank you.
Yeah, thank you. I think really, I mean, you made a very good point. And
Thank you so much, Dr. Dey, for enlightening us regarding the air pollution and the health risk. We are in Jodhpur, and you said that the national average is above 100 or close to 100. The Jodhpur, the year average, the annual average is close to 100, and which is above the national average of pollution. AIIMS Jodhpur is middle of the industrial area, and we have a lot of industries all around. What kind of, and you also mentioned that the PM2.5 particle concentration, we need to shift our thought process to the type of the particles. Now, what kind of particles which could be here if you have measured, and what health risk it can impose on the dwellers, the patients, the relatives, and the healthcare workers, and what steps we can take other than shifting these industries so that we can protect our health?
yeah, I mean, it's important questions. Obviously, what can be easily measured is the total PM level. But to know how much of that is different species and then link to how much is coming from industry or vehicles and all, you need to do further chemical analysis. That is little bit time consuming. But if this campus is close, I mean, I just saw that industry is just outside, I mean, across the road. So definitely it means that there will be an impact. Now, typically from my experience, I don't know what type of fuel these industries are using, but most of the industries, they burn some sort of fuel, which means that they are emitting black carbon, they are emitting all those secondary pollutants that I talked about. And from limited studies, it is very clear that those pollutants are more toxic. So that's what the literature is suggesting. Now, obviously, completely shifting and all is a different policy ballgame, but immediately, obviously, in terms of reduction of pollution, there are certain technologies which can be taken at least in the major hotspots like OPD and all. Like in AIIMS Delhi, I know the new director, when I met him, he mentioned to me that they're going to stop outside vehicles, and within the campus, they are planning to only run electric vehicles. So that at least, because his thought process was that the patients are coming and then the vehicles next to it is actually emitting. And we know that vehicle emission is really, toxic and all. So some of these small scale measures, now this campus is quite green, I saw. But this is very unique. Actually, I have not seen, so close industry is placed. Most of the places like in Delhi, alone industry has been moved out because of mainly these reasons. But yeah, I mean, if the industry cannot be moved out, but then there are certain technological interventions we can discuss in more details, which can be thought of at least to minimize some of the exposure risk, particularly not everywhere, but at typically where the footfall is more. For example, OPD and some other places.
Dr. Dey, excellent insight into the pollution in the city and the country.
Thank you.
And the one thing, when we talk about the indoor house pollution, so is PM 2.5 is a good indicator of indoor house pollution? And what are the specific constituents of the pollution which are predominant in the indoor house pollution?
Yeah, I mean, indoor or outdoor, PM 2.5 is a good indicator. The challenge with indoor is that you cannot measure from satellite or any other instruments. You have to deploy the instrument inside the houses, which has only been done in certain cohorts and other studies. Having said that, if you look into the statistics, the major source obviously is solid fuel, which is burned for domestic activities in rural households, and not in rural, even in many urban slums and all, people are still using solid fuel. But we have done a survey in Delhi, indoor air pollution levels in different microenvironment, like this kind of auditorium, cinema halls, restaurants, where LPG is used, and then again within schools, colleges and all. So almost 12 different microenvironments. And what we found is that indoor air pollution level is almost at par with outdoor. And this is the reason is that except place like this, which is kind of centrally air conditioned, most of the indoor environment, there is free air passage. So typically the indoor-outdoor ratio is very close to 1. If outdoor is 100, your indoor is almost 90 or something. So this conception that urban indoor places is safe in terms of air pollution level is not true. And I'm very sure if you measure in any city, in any microenvironment, you will get. Now, for indoor, you ask what type of components and all, that has never been measured.
Okay.
What is only measured in India is that total PM level.
Okay. So normally the advisory which comes when the pollution levels are high, the government says stay indoors, so that might not help.
Yes.
Okay.
If you say, and this is again this, if you recall last year when schools were closed in Delhi, 2 days pollution level went up to 400 during that Diwali period. Then the counter argument was that, the children, you are stopping them from coming schools, but their houses are equally polluted and children anyway play outside. So it does not make much sense actually, yes. So remaining indoor, you measure, there are instruments now. Indoor pollution level is also quite high unless you use a purifier.
Okay. And just one observation also. So you just discussed that in the months of May and November there's higher pollution peaks in Jodhpur. So these are the months when we see, so I'm a pulmonologist, so we see more patients of respiratory disease presenting with exacerbations. So earlier we were thinking the season change might be the reason behind these exacerbations, but one underlying reason might be the increase in pollution during those months.
Yeah, it could be. I mean, because the data is there, and if you have also daily data, right, hospital admission or OPD visits, and also very quickly a time series study can be done to answer your question exactly. How much you can attribute to the increase in the pollution level.
I think that we can discuss after this presentation.
Thank you.
Sir, just I wanted to know how effective is the air purifier tower?
So towers are not very effective, frankly saying. We have done studies. Purifiers are always effective in closed condition indoor.
Because Chandigarh have been using that.
No, I know. I mean, but the thing is that even in Delhi, so much has been said about the smoke towers and all. They are not cost effective at all. Their effectiveness is mostly confined within 250 to 300 meter radius. Okay. So if you measure actually, and we have measured, within 200 meter, the pollution level goes down, but the point is that there is no people exposed in that region. And the cost of the smoke tower, I don't know the cost exactly of Chandigarh, but the Delhi smoke tower cost is 36 crore. And now if you do a cost effective analysis, it's not at all cost effective. And most important thing is that to running that smoke towers, you need electricity. And that electricity is not coming from solar, but coming from coal, from power plant. So it's just, you are trying to clean one place by burning and polluting more in another place.
Thank you.
Okay, thank you.
Thank you, Dr. Sagnik, for the wonderful insight. And I feel that all of us are being sensitized here and they are looking forward to work in this direction. I would now request our Dean Academics to felicitate our guest speaker and our HOD ma'am to join him on stage. Thank you, sir.